Artificial intelligence, AI, and robotics are increasingly becoming integral components of the healthcare landscape, prompting discussions about their potential to assume roles traditionally held by human doctors. This comprehensive analysis explores the multifaceted dimensions of AI and robotics in healthcare, examining their current applications, potential to function as autonomous medical practitioners, ethical considerations, and the future trajectory of these technologies. 1. Introduction to AI and robotics in healthcare. AI refers to the simulation of human intelligence processes by machines, particularly computer systems. In healthcare, AI encompasses machine learning algorithms, natural language processing, and robotics to perform tasks such as diagnosis, treatment planning, and patient monitoring. Robotics involves the design and use of robots to perform tasks with precision and consistency, often assisting in surgeries, rehabilitation, and patient care. 2. Current applications of AI and robotics in medicine. The integration of AI and robotics in healthcare has led to significant advancements. Diagnostic imaging. AI algorithms analyze medical images to detect abnormalities, aiding radiologists in identifying conditions like tumors or fractures with enhanced accuracy. Surgical assistance, robotic systems, such as the Da Vinci surgical system, enable minimally invasive procedures with increased precision, reducing recovery times and improving patient outcomes. Patient monitoring. Wearable devices equipped with AI monitor vital signs in real time, alerting healthcare providers to potential issues before they escalate. Administrative tasks. AI automates routine administrative duties, including scheduling and medical record management, allowing healthcare professionals to focus more on patient care. 3. The concept of robots as autonomous doctors. The notion of robots fully assuming the role of doctors involves several considerations. Clinical decision-making. AI systems can process vast datasets to suggest diagnoses and treatment plans. However, the complexity of human health and the need for nuanced judgment present challenges for fully autonomous decision-making. Patient interaction. Effective healthcare relies on empathy, communication, and understanding qualities inherently human and challenging to replicate in robots. Ethical and legal implications. Assigning medical responsibilities to robots raises questions about accountability, informed consent, and patient trust. 4. Case studies and real-world implementations. Several instances highlight the integration of AI and robotics in healthcare. Xiaoyi. Developed by Eifly Tech in China, Xiaoyi became the first AI-powered robot to pass the National Medical Licensing Examination. Designed to assist human doctors, Xiaoyi exemplifies the potential of AI in medical knowledge application. NHS Skin Cancer Diagnostics. The Chelsea and Westminster Hospital in London implemented an AI system capable of providing instant skin cancer diagnoses. This technology allows for rapid assessments, with nearly half of the patients receiving immediate all-clear results, thereby reducing waiting times and expediting treatment for those in need. 5. Public perception and trust in AI doctors. Public acceptance of AI in healthcare is crucial for its successful implementation. Trust levels. Studies indicate that while there is openness to AI assisting in healthcare, many patients express discomfort with AI making autonomous medical decisions. Building trust requires transparency, education, and demonstrable efficacy. Cultural variations. Acceptance of AI in medical roles varies across cultures, influenced by factors such as technological familiarity, healthcare infrastructure, and societal values. 6. Ethical and regulatory considerations. The deployment of AI and robotics in healthcare necessitates careful ethical and regulatory scrutiny. Accountability. Determining liability in cases of AI errors is complex. Clear guidelines are needed to assign responsibility among developers, healthcare institutions, and practitioners. Data privacy. AI systems require access to extensive patient data, raising concerns about confidentiality and security. Robust measures must be in place to protect sensitive information. Bias and fairness. AI algorithms can inadvertently perpetuate biases present in training data, leading to disparities in care. Continuous monitoring and updating of algorithms are essential to ensure equitable treatment. Point 7. The complementary role of AI and human doctors. Rather than replacing doctors, AI is poised to augment medical practice. Enhanced diagnostics. AI can provide doctors with comprehensive analyses, supporting more accurate and timely diagnoses. Personalized medicine. By analyzing individual patient data, AI facilitates tailored treatment plans that consider genetic, environmental, and lifestyle factors. Operational efficiency. Automation of routine tasks frees up doctors to engage more deeply with patient care, improving overall healthcare delivery.
8. Challenges and limitations. Despite the promise of AI and robotics, several challenges persist. Technical limitations. AI systems may struggle with uncommon conditions or atypical presentations, necessitating human oversight. Integration into existing systems. Incorporating AI into current healthcare infrastructures requires significant investment and training. Resistance to change. Healthcare professionals and patients may be hesitant to adopt new technologies, emphasizing the need for gradual implementation and education. 9. Future directions and innovations. The trajectory of AI and robotics in healthcare points toward continued innovation. Advanced robotics. Future robots may possess enhanced dexterity and sensory capabilities, expanding their roles in surgery and patient care. AI-driven drug discovery. Machine learning models can expedite the identification of potential therapeutic compounds, accelerating the development of new medications. Telemedicine integration. AI can enhance remote consultations by providing diagnostic support and monitoring, making healthcare more accessible. 10. Conclusion. While AI and robotics are transforming healthcare by enhancing diagnostics, treatment, and patient care, the complete replacement of human doctors remains unlikely. The future envisions a collaborative model where AI and robotics serve as valuable tools that augment the capabilities of healthcare professionals, leading to improved patient outcomes and more efficient healthcare systems. As we've explored today, the role of AI in healthcare is both groundbreaking and complex. While robots and intelligent algorithms are reshaping how we diagnose, treat, and care for patients, they are not here to replace human doctors but to assist, enhance, and support them. The future of medicine lies in a powerful collaboration between human intuition and artificial precision. As AI continues to evolve, so does our ability to deliver better, faster, and more personalized care to everyone, everywhere. If you found this video insightful, don't forget to like, subscribe, and share it with others who are curious about the future of AI. I'd love to hear your thoughts in the comments below. Do you think robots will ever truly replace doctors? Let's talk about it. Thanks for watching, and see you in the next one.